I remember when President Obama was finishing, his last year, he gave a commencement address at the Air Force Academy. And I went down, I was the governor, and we ended up having lunch together in the training room. But in that lunch, I asked him, after 8 years as being president of the United States, what kept him up at night? What was the single thing that most concerned him? And he said cybersecurity, especially the way it would interface with things like healthcare that were absolutely essential to our country, which was interesting because I'd come back on a trip to Israel and seen how their cybersecurity industry was so connected to their military and so connected to their universities, and that people would come out of the military and go work in a business, then go study and then teach. So we set up something called the National Cybersecurity Center in Colorado Springs, just because we have Northern Command, NORCOM, and Space Command, a lot of intelligence there, a lot of retired military officials. And I think that building that citadel towards cyber resiliency and awareness and training and education, just what all of you guys are doing, was one of the most rewarding things I did in the entire time I was in office. I especially love the term "I am cavalry." I am the cavalry.org has got to be one of the best names. I wish we could have thought of that. Anyway, this notion of how much there is to do, and I'll start with Ms. Anderson. How can the Health ISAC work within the National Cybersecurity Center, or all the other federal level groups, to provide sector-specific guidance?
So we do that every day. Actually, we work very closely with CISA and HHS and FDA. We have, as I mentioned in my testimony, we do have weekly meetings where we're looking at issues facing the sector, and we're addressing them and trying to figure out what's the best way to handle whatever the situation is. So we are partnering very closely with them. Also, another thing, during the whole Ukraine-Russia tensions, we've been part of all of the briefings that have taken place, and then we have foot-stomped those messages out to our members and the public writ large about things that they need to really be paying attention to.
All right. Good. We, like everyone, have experienced devastating attacks, and especially ransomware attacks. We had 5 years of records taken from the Parkview Medical Center down in Pueblo. Last year, one of our universities refused to pay the ransom. It was a $17 million ransom when they were hit by the Excellion data breach. When colleges and universities are attacked and hospitals are being attacked with sensitive data like health information and visa status, Social Security numbers, I guess, and Ms. Narswan, I ask you, why is it so critical that we don't pay these ransoms?
I think when a ransom is paid, there's no guarantee that you're going to get your data back, although there are some stats that show about, I think, 68% of the time it does come back. In addition, there's no guarantee that your data won't be published, and that's another, I think, aspect of ransomware, that while the operational disruption is really critical and really impactful, there's also the threat of releasing that data out into the dark web and for it to be misused. I think that it highlights the need to be prepared for a ransomware attack, to do the things that we need to do, have a good backup, have a plan, test the plan before you get a ransomware attack. Don't do it the first time when somebody is asking you for a ransom. So I think that that's the critical way to go. It's so disruptive because it impacts the operation, and the timing is always, they know when to time it, right? So they time it at a university at a time of admission or final exams so that it has the worst impact and that you'll be more inclined to pay the ransom.
And the only way to deal with it is to be prepared. I agree completely. Mr. Corman, real quickly, just because I'm almost out of time, we have a large campus of NIST in Boulder, Colorado, and they're currently in the process of updating the framework for improving critical infrastructure cybersecurity. While this guidance is voluntary in the private sector, it is a critical resource for companies that are looking at how they can protect themselves. Given that healthcare has been deemed a critical infrastructure sector, how could NIST best tailor the updated guidance to meet the evolving cybersecurity needs of healthcare systems?
The NIST framework's nearly a decade now and voluntary, and the recent OIG report showed there's very little adoption. So it is necessary and insufficient. And I think you've seen some excellent work from the 405D and the Joint Working Group in the ISAC and the Sector Coordinating Council attempting to give that sector fit-for-purpose advice on how to do it. People do things when they're incentivized to do them. And a decade later with voluntary, the adoption is quite low. And even where it is, it's amongst the haves, not the have-nots. I think we need carrots and sticks. If we're going to offer safe harbors, they should be tethered to an attestation about your current state of practice against such a framework. A tool that is never used does not realize its potential.
I couldn't agree more. Thank you. I'm out of time, but I will have questions for each of you that we will filter through the appropriate channels. I yield back to the Madam Chair.
Thank you.